Hi, this is William Simmons with Medicare Strategies. This video is a more detailed educational video regarding Medicare supplements, which are also known as Medigap plans. Now, Medicare supplements are designed to cover deductibles and copays and coinsurance amounts that are not covered by original Medicare Parts A and B. If you enroll in a Medicare supplement, Original Medicare, your A and B card will be your primary insurance. And everything is driven off how Medicare responds to your claim. If Medicare pays your claim, then the Medicare supplement company will come in and pay what they're legally obligated to pay. If Original Medicare does not pay the claim or they deny the claim, then the Medicare supplement company will not pay either. Everything is driven off Original Medicare. In Original Medicare, we talk about Parts A and B of Original Medicare. That is uh, offered and administered by the Centers for Medicare and Medicaid Services, often referred to as CMS. Now, there are three specific components I want to focus on for this video. The first is that Medicare supplements are offered by private insurance companies. Two, the Medicare supplements are identified by plan, such as Plan A, Plan B, Plan F, etc. And the third is that Medicare supplements require an additional monthly premium. Now, the first, and I alluded to this a little bit earlier, um, Medicare supplements are administered and offered by private insurance companies. The Centers for Medicare and Medicaid Service, they do not offer Medicare supplements. They administer original Medicare Parts A and B. So if you're using original Medicare Parts A and B as your primary insurance, when you see a service provider, they will submit the claim to the Centers for Medicare and Medicaid Services. Once the Centers for Medicare and Medicaid Service determine that is a claim they will pay, then that gets communicated to your supplement company, who then pays their share. But all of these Medicare supplements, you must go through private insurance companies to obtain. Now, this is something that's very confusing for many people because Original Medicare has Parts A and B, and there are also parts of Medicare, Part D, that is prescription drugs, and Part C, that identifies the Medicare Advantage plan. Medicare supplements are plans. So we have parts of Medicare, Parts A, B, C, and D, and then we have plans. Now, what can be confusing are that the Medicare supplements are identified by letters as well. So unfortunately, we have Plan A, Plan B, Plan C, Plan F, Plan G, Plan N, and that gets confusing for many people, especially when you're receiving information in the mail about all these different Medicare parts, and then you get information about Medicare supplements, which are plans, and it can be very confusing and is very confusing for many people. But just remember that Medicare supplements are plans, not parts. Parts of Medicare are original Medicare, Part A and B, and then you have Part D for prescriptions and Part C for Medicare Advantage plans. Medicare supplements are plans. Plan F, Plan G, Plan N. Now, each plan has a specific structure or a specific number of benefits that it covers. So when you're meeting with a Medicare agent, you want to make sure that you understand the different nuances of each plan. Is there a deductible or copay that is not covered by a certain plan? And just make sure that you understand the different options and the different coverage that each Medicare supplement plan offers. Currently, the two primary supplements that are seem to have more interest are the G plan supplement and the N plan supplement. Frankly, the G plan supplement covers the most deductibles, copays, and coinsurance amounts that is available or allowable by Medicare for individuals who are currently turning 65. In the past, there was a Medicare supplement known as an F plan that covered all deductibles, copays, and coinsurance amounts. But unless you were born um, or unless you turned 65 before January the 1st of 2020, you will not be eligible for the F plan. Now, here is an example of a G plan supplement, and as far as what it covers, the AG plan will cover the hospital deductible, which is currently $1,566. It will cover 100% of that. It will also cover 100% of the 20% coinsurance. Part B does have an annual deductible that is not covered by Medicare, or that is not covered. So if you are using original Medicare and you have a Plan G supplement, the first time you have a Part B service, which is an outpatient service, you will have to pay that $233 deductible. After you pay that deductible, it should pick up 100% of your outpatient service deductibles or your coinsurance amount. So it's an excellent plan with excellent coverage, but this is just to show you an example of what a Medicare supplement, how they function. Now, Medicare supplements do have monthly premiums, and there are different premiums. People ask me, why do different companies have different premiums? Well, that can depend on a lot of different factors: the utilization of their current plan members, what they're anticipating their plan to pay out in the future years. But you can expect you're going to have a monthly premium, and you can expect annual increases as well. Every company is going to have different increases. Now, depending on the company, you will have different premiums between males and females, for different premiums between smokers and non-smokers, and age is certainly a factor in the majority of plans. Um, Always be aware of what the different premiums are, and when you're looking for a Medicare supplement, it is wise to compare 2 or 3 companies to make sure that you are paying a competitive premium. No agent can guarantee you what the premiums are going to be in the future years. I wish I had a crystal ball to do that. Unfortunately, I do not. But it is a matter of there will be premium increases, and you just need to prepare yourself for that. And here is an example. If someone enrolls in a Medicare supplement, this is an example of the monthly premiums that you would incur. Since original Medicare is your primary insurance, you will have to pay the Part B premium, which currently the base premium for Part A or Part B is $170.10 a month. A Medicare supplement premium for this, I think, a male 65 in the area that I live in, it may be a little bit higher, but this gives you an idea. $125 a month. I think maybe 135, maybe a little bit more accurate now. But it depends on the discount that if you qualify for a family discount. For most Medicare supplements, when both the husband and wife or both spouses enroll in a plan, they will offer you what's called a household discount. And that household discount usually is in the range of between 7% and 12%. So both spouses would receive that discount percent on their monthly premium. But this is really just an example. You have your Part B premium, your Medicare supplement premium, and because original Medicare does not cover prescription medications, you would want to consider enrolling in a Part D premium if you want prescription drug coverage. And $30.50 is the national average for, I believe, for 2021. So that gives us just a place to start. As you can see, you would be looking at premiums every month of around $325 and some change. The positive about that is your Medicare expenses for medical care would be well covered. You would have very minimal out of pocket for medical coverage. Now, Medicare supplements do not cover copays and deductibles for prescription drug plans, only for medical care under Part A and B of Medicare. But this gives you an example. This is the end of this video where I dive a little bit deeper into Medicare supplements. And always, if you have questions about Medicare or Medicare supplements, you can contact my office at 256-425-8614. Thank you for watching, and I hope that you have a great day.